So thank you so much for having me. My name is Courtney. I am a psychiatric mental health nurse practitioner, and I am very excited to talk about mental health and cancer today. All right, so a little bit about me. I am an osteosarcoma survivor. In 2017, I was training for a marathon. I was running about 8 miles a day. I felt great. Everything was good. I started to get like this little bit of pain, and I thought, oh, I'm overdoing it. I need to cut back. Maybe I'm not stretching properly, etc. I kept running, I kept training. The pain was starting to get a little bit worse and a little bit worse. Ibuprofen and Tylenol became my very best friends for many, many months. Over, a couple more months, I saw a couple of doctors. They said it was either sciatic pain or I needed to go to physical therapy. So I was sent to physical therapy for about 6 months. I did all kinds of stuff. I got diagnosis after diagnosis of, slip disc and all of this stuff. They did tons of dry needling where my pain was, and that was extremely painful. Through this whole process, my pain was getting so much worse and so much worse. I finally went to my doctor and just begged for an MRI. And I finally got an MRI. And after about 2 years of misdiagnosis, I met my orthopedic oncologist at Dana-Farber and was diagnosed with osteosarcoma in my pelvis. I went through months and months of chemotherapy. I was extremely sick the whole time. I really had a hard time with the regimen. I was pretty much inpatient for that whole year. I've got 2 little girls who spent most of the time FaceTiming me in the hospital and being my best little nurses at home. I ended up receiving a hemipelvectomy, and a large chunk of my iliac crest in my pelvis was removed. I've had to learn to re-walk. Today, I'm still supposed to be walking with a cane. However, I'm not the best patient, and my doctors know that. I am unable to run, play tennis, rock climb, and some days even do the laundry and do a lot of bending. But I did survive. During my diagnosis, I was actually in graduate school to become a nurse practitioner, and I was working on the floor as a psych nurse. Even as a mental health professional, I really did not notice the impact of treatment on my mental health. When I saw my oncologist for a follow-up scan, right after chemo ended, I remember him rolling his chair over to me. He placed his hands on my thighs and really just said, now it's going to get hard. I started crying. I had like so much of this built up emotion that I held in just so I could focus on treatment that whole time. But when it was over, it really hit hard. This was really the first time my mental health had ever been formally addressed throughout my entire treatment regimen. After several months of finishing treatment, I immediately re-enrolled in my program to finish my graduate degree. Since then, I really dedicated my career as a psychiatric nurse practitioner to helping support cancer patients, their families, and those in survivorship. So that's a little about me. So I want to start by kind of talking about the importance of this discussion today. So 33% of cancer patients will experience mental health issues before treatment, during treatment, and after treatment. 25% of cancer survivors experience depression and 45% experience anxiety. Cancer patients are at 2 to 3 times higher risk of completing suicide and 19% higher death rate among cancer patients with mental health issues. But even with these really high statistics, we're really only seeing that 5% of people get help when it's needed. 49% of patients report that they receive no support or advice from providers related to mental health, and 66% note no warning about the avalanche of feelings that can really come with the end of treatment. So why only 5%? Well, let's first talk about the stigma of mental health. What does stigma even mean? I think that word is thrown around a lot, but stigma really comes from a lack of understanding and fear about something. Mental health is still very stigmatized in our society, as is portrayed through the media and movies. And we also have a self-identified stigma of really not wanting to identify that we may be having a mental health struggle. But really what happens is with this stigma, it leads to a reluctance to seek treatment or talk about how we're really feeling. We can really become isolated and feel really misunderstood by our family and friends that really just don't understand. Truly, our goal as providers is to spread awareness about mental health and reduce the stigma. We want to be able to talk about mental health as easily as we want to talk about any other diagnosis. Providing education and having conversations like this today is the only way we can continue to facilitate this. Okay, so I'm going to talk a lot in the next few slides. We're going to start with some of the probable diagnoses that we can see during treatment. So first off, not all cancer patients feel the same. Some patients don't experience any impacts on their mental health during treatment, while others struggle immensely. It's not black and white. You may be at higher risk of distress if you felt depression or anxiety before cancer even started. First off is anxiety. So really, what is anxiety? Anxiety is the body's truly natural response to the fear of the unknown. It's very expected. I would honestly be worried if we didn't have some level of anxiety throughout our cancer diagnosis. Really, the problematic piece of anxiety is when it becomes overwhelming. It's starting to impact our day-to-day functioning and even our quality of life. The anxiety can feel extremely excessive. You may find you're not able to control it with coping skills how you may have used to been. You might notice you're feeling very restless or on edge. You're increased fatigue. You might feel really irritable or snappy. It can even cause sleep disturbances. We can have a lot of those racing thoughts and fears at night before we go to bed, or we can wake up in the middle of the night and anxiety is still right there. We can also notice that we found that anxiety can happen before treatments, and it's correlated to actually having more nausea and vomiting and even increase in pain. Anxiety for some people can delay treatments out of fear. I kind of describe anxiety to some of my patients as like this running movie in your head. If you can just imagine that, of the thoughts just running over and over and over, and you just can't seem to get them out of your head. It can honestly feel pretty debilitating. We can also talk about anxiety in reference to scanxiety, which I know we touched on yesterday, but it's really just this extreme worry and dread that come before scans. It's the fear of the unknown. We're like, is the cancer spread? Is our treatment really working? Or are we having a relapse? I really want to talk about some of the coping skills we can work on before scans in some of the later slides. Then we're going to talk about depression. So the big bad wolf depression. I know we have all seen commercials for antidepressants on TV. I guarantee we all know at least one loved one, with depression. Even throughout our own lives, we may have experienced periodic depressive days. That's totally normal. You have a down day, 1 or 2 days, you're really not feeling good, but typically you'll bounce back after that and return to your normal functioning. But this is really not the case once we lean towards more of a major depressive disorder. A true depressive episode is really one where you feel really down, you're really sad, you feel just blue, you're not enjoying life, you're not finding pleasure or joy, and you feel like this day after day. You wake up with it, you go to bed with it, and it's going on for at least 2 weeks or more. During this time, we got a lot going on in our brain. We might be crying more frequently, just having crying spells for no apparent reason. You might feel more irritable or frustrated than you normally would. Our sleep patterns can change. We may find ourselves sleeping a ton, even having trouble even getting out of bed, or we might just be not sleeping at all and experiencing a ton of insomnia. Your energy and your motivation are pretty low during this time. You may find yourself eating less frequently, not really feeling hungry, or overeating. Your brain can feel really foggy. You're having trouble concentrating. Even when you feel depressed, you may notice that you have like episodic periods of smiling or feeling joy, but often these periods are very short-lived. Depression can really come at any point during treatment, even when treatment is over. Oftentimes, depression comes on pretty subtly. It progresses over time in a way that we may not even notice a change in our mood or functioning. This is especially true when we're fighting cancer. We're already so overwhelmed due to our focus of treatment and recovery, we often don't really think about anything else. Depression can even be increased when our pain of cancer is not well controlled. You might start to feel like you're a burden, you've lost your independence. Some of us with poor prognosis or very difficult treatments and changes like life-changing surgeries, depression can be increased. Even some of our chemotherapies and our medications for side effect control, all of those can lead to feelings of depression. You can also experience feelings of guilt and hopelessness and suicidal thoughts. Thoughts of suicide are completely not uncommon throughout treatment and post-treatment. We can have a few different types of suicidal thoughts. We refer to some as passive thoughts. This is kind of a thought that comes into your head out of the blue. It really doesn't linger long. It's more like, if I didn't wake up tomorrow, I would be okay. You're not really thinking of harming yourself. However, this can switch into active suicidal thoughts where you really are thinking of ways you're going to hurt yourself. You're making a plan, you're writing goodbye letters, you have a real intent to harm yourself. And that's really when we get concerned. But I don't want you to feel ashamed of having those thoughts. Cancer is completely overwhelming. We sometimes don't even know how to cope or manage, and that's what comes to us the easiest. Suicidal thoughts can be so compounded because we have both physical and psychological factors going on at the same time. But the most important piece is to speak up when you have these thoughts. I don't care who you talk to, your family, your friends, you call your providers, it doesn't matter, but you have to talk. I've included the National Suicide Prevention Line here. You can call that number, you can text that number. Please locate crisis centers near you. There's tons of crisis services now that we can reach out to. Don't hold it in. There's definitely help out there. And, you know, September is also National Suicide Prevention Month. So it's another time we just need to think and be cautious and really reach out. And then we've got trauma and PTSD. So PTSD is post-traumatic stress disorder, which can occur when people are exposed to an actual threat or death, serious injury, or even witnessing a trauma. We might associate PTSD so often to veterans coming back from war or people that had really traumatic childhoods. But cancer patients can experience trauma as well. We go through a lot from the day we're diagnosed to even years down in recovery. There's a lot going on during that time. The disorder can really keep us from getting our necessary tests, going for treatments, doing follow-up care. It can also affect caregivers. It is estimated that about 20% of parents of a child with cancer can also experience PTSD. So what are some of those symptoms? You can have nightmares and flashbacks. Things can take you right back to the moment. I've heard other people say they have a flashback right back to when they woke up from surgery and things like that. You might start finding yourself avoiding places, events, or people that may bring up bad memories. You'll find yourself maybe unwilling to talk about any of it. You find yourself pushing it all the way to the back of your head and locking it up. You don't want to think about it. You might have some feelings of guilt, hopelessness, or shame during that time. You might have trouble sleeping or concentrating. We have these things called intrusive thoughts, and these are basically thoughts that can just fly into our head out of the complete blue. Maybe you're just sitting watching TV, you're totally fine, and then all of a sudden you have a thought come into your head about some sort of trauma of our cancer diagnosis, and it can be very troublesome for you because then at that moment it can take you back again. You can feel those emotional feelings that come with thinking about that. You may notice, you lost interest or pleasure in things that you used to enjoy prior to your diagnosis. Some people used to maybe love cooking and then they were unable to cook anymore. They had all of this stuff and now they'll never cook again. PTSD can really lead to some pretty self-destructive behaviors like drug use or alcohol or substance use. to kind of keep those thoughts at bay. You may even find that you're having difficulty feeling emotions anymore. You feel really flat. You just have a hard time making relationships. You have a hard time trusting people. It can be very difficult to deal with, but it's a very real thing that we need to talk and consider. And then finally, we're going to talk about grief. The first thing I want to say is there's absolutely no right or wrong way to grieve. We all experience everything in our life differently. We all have our own stories, and that's really why grieving is a very unique process. No one should ever tell you how to grieve, and you should not feel bad because you don't grieve in a certain way. When thinking about grief and cancer, I think there's a couple of different things to think about. We can think about, traditional grief of losing a loved one, but we can also really think about all the other grief that can come with it. We can grieve for our past lives. We can grieve for our future lives of things we won't be able to do because, we don't have the same strength in our body like we used to. We can grieve for our lost time that we have spent in treatment, in the hospital. We can grieve for our families, our spouses, our children, everyone that's affected by our diagnosis. And then, of course, our loved ones can grieve for us. We grieve for life that's there and life that's lost. We can also grieve for childhoods. We can grieve for the childhood that our child might not be able to experience, or the childhood that their siblings can no longer experience. And we can grieve for cancer friends and family we met along the way. There is a couple stages of grief that we kind of recognize. So we've got like denial, where we don't accept it. We don't believe that this is our fate. We have anger. Anger is very natural, and anger should never be suppressed when we're thinking about grief. It is a way of healing. We have bargaining, hoping that if we do this or we do this, it'll get better, it'll go away. We of course have depression, like we just talked about. And we have acceptance, where it doesn't mean we're happy about the situation, but we have come to understand what a new normal may look like for us. But there's really no timeline for any of this. You can go from, bargaining to denial, back to bargaining. It can take you a year to be in the denial phase. There's really no right or wrong way. But what's really important is that you truly give yourself the time to grieve. That's how we move on. That's how we help to heal ourselves. If we bottle it up and never give ourselves that chance, it's going to be much harder to ever move on into what we would consider, I guess, our new normal. But kind of what we've talked about with all of these diagnoses is the most important takeaway from this is to be your own advocate. If you're starting to feel this way, if you're not sure if this is normal, then reach out. Reach out to your providers. They can help you. They will find you the resources that you need. But I think what I was trying to get at with this slide is for you to understand what you might be feeling and how this can affect you. So asking for help. Sources can include palliative care, psycho-oncology, psychiatrists, nurse practitioners, social workers, and of course your team. So what is even psycho-oncology? This is a cancer specialty that addresses really the physiological, the behavioral, and the emotional issues that arise from patients and loved ones. There's often a misconception about what palliative care is. It's often associated with this feeling of hospice, or it means I'm dying. But really, it's just a specialized medical care for people living with a serious illness. And it really aims to optimize quality of life and reduce our suffering. Palliative care can help address so many different things. They can help with side effects from medication. They can help with pain management. Even in our breakout group yesterday, the four of us kind of discussed what palliative care is and how it's helped us. Really, the takeaway from our discussion was to really seek these services early. I was not referred to palliative care till very late into my treatment, and it was enormous, the help they provided me. And I really wish I had been, offered that help very early on. So it's really important to know about some of these other options for you. We've also got our oncology social workers. Social workers can help provide a lot of different things. They do individualized counseling. They can help with case management and dealing with your whole team. They run support groups or help you find support groups, or even locating other services. They can help with like applying for disability, help with, taking FMLA time, financial assistance, help find you grants. They can help with transportation. I really encourage you to seek out your social workers and see how they can help you. And of course, we can do counseling. Counseling sometimes gets a bad rap. Not everyone wants to go and talk about their feelings, and I get that. It can be hard to meet, a stranger, and then all of a sudden you're supposed to spill your guts. But honestly, when you find a good counselor that you really bond with and you build rapport with them over time, they can help you so much. They can help us learn how to change, live with these unchangeable realities. We can learn how to manage the fears and anxiety and depression. They can help us manage those fears of reoccurrence and those fears of anxiety and what sort of things we can do at that time. The real hope from, counseling and therapy is to take away the driving power of fear. And that's really what comes down to a lot of our mental health diagnoses and cancer. It's just that fear. But I do encourage you, if you are searching for a counselor or a therapist outside of your health system and it wasn't, you weren't sent to them, try to find someone that has specific cancer experience. They can understand both the spectrum of how cancer treatments, physical health really go into our mental health as a full picture. And that's really important to find someone that truly understands that. We've also got this new age of telehealth and virtual care. This is amazing for mental health patients. We don't always have the access to treatment. We don't, in our towns, we may not have a mental health specialist. We may have to drive to get anyone. And it's really important because now we can remove those barriers of safety, especially during coronavirus. We don't have to be seen in person. We can still get help. If we don't have transportation or we can't drive or we just honestly don't feel good, we don't want to get in the car and drive and sit, in an office for an hour. We can do it in the comfort of our own home and still get the care we need. And then coping skills. Excuse me. So I think coping skills is a term that is thrown around a lot. We hear you've got to manage your coping skills, you got to learn new coping skills. But really, what does coping skills even mean? It's really a method that people use to deal with stressful situations. Everyone's methods can be different. You have to find a way for your skills to work for you. There's absolutely no expectations. We're finding ways to decompress. We're finding ways for distraction. Some of the things I wrote down to think about that may help, aromatherapy is very helpful. It can help in a lot of ways. Lavender is very calming. You can find necklaces that have little felt in them. You can drop some of the essential oils on. There's, peppermint. I remember being given peppermint in the hospital to hold when I was feeling very nauseous. You could think about taking a warm bath if you're feeling very overwhelmed or anxious. I encourage you to think about learning a new hobby. It doesn't have to be anything crazy. Maybe you learn to knit. Maybe, my mom, when she had cancer, she has started really love to bird watch and feed all of her birds and do that. You could, start blogging. Some people find it really beneficial to journal and talk about their feelings and have other people weigh in on it. Maybe you start a new book series. Or you can even just watch Netflix. That's cool too. That's still a coping skill. We can scrapbook, we can paint, there's tons and tons of those coloring books now for adults that you could consider. It is what it is. You have to find what works for you. Try talking to a friend. If you're just feeling down, you're just not feeling good, then try to reach out. Family, friends, maybe try to go out for a cup of tea. Think about just getting out of the house, even just the sunshine, regardless of your activity level. You could try to even just walk around the block. Go for a drive with your loved ones. Maybe go look at the fall leaves. Anything really to just help ease your thoughts, help ease your mind. Some of the stress reduction things you can do is form schedules. Find ways that you still can, things that are in your control, focus on those. Cancer feels so much out of our control. We don't really control a single piece of it. We just kind of follow along of what we need to do. But that can be really difficult because some people really, we like control in our lives. But find control how you can. Make yourself a schedule. Figure out new ways that provide you with that sense of relief. I remember hearing from one person before is, do what you can, admit what you can't. I think that's super powerful because we have to think about this is our new normal, and that's okay. It's hard. It's not always easy, but find things that work for you now. You can join support groups, find connections with others. Even when I posted about the blog of Scanxiety, a lot of people on Facebook shared how they deal with Scanxiety. So just finding new outlets. Support groups. Support groups can be beneficial for some and not beneficial for others. It's really up to you and what you're comfortable with. They can be very formal, they can be informal, they can be online, in person. You can join groups for all stages. Maybe you want to join a survivorship group or, certain support groups for surgical patients. You can seek, spiritual support for caregivers, support for families and children. Support groups overall can really improve quality of life. They've shown to enhance survivorship. You can feel better about yourself. You can find new focus in life. It's said that support groups help with better pain management and side effect management. You can even meet new friends. You need to form a connection with those who understand and have been there. We can find, support groups. Our families are so supportive to us, our friends, all of that is so supportive, but really support groups, whether, it's a Facebook group, it provides supplemental support that comes from a different angle than our family and friends because it's truly from people who understand. If you're looking to find a support group or looking to learn how to start a support group for your area, on the Sarcoma Alliance website, we do have some information on that, which I think is awesome. Now I'm just going to touch on humor. I found humor ridiculously helpful throughout my treatment. I said things that were probably completely inappropriate all the time. I had providers look at me funny. My family looked at me like I had two heads sometimes. But for me, that was how I coped. When I got my tumor, I ended up naming my tumor Tony the Tumor. Tony stuck with for most of my appointments. My providers knew what his name was. We had lots of jokes surrounding Tony. Sometimes we have to make light of a really difficult situation. Laughing can even help improve, your health overall. It stimulates circulation throughout your body. It can help relieve some tension in our muscles. Humor isn't for everyone, and that's fine. If you find, that humor helps you, then I say go for it. We can always make light of stressful situations, and sometimes just having a laugh, even on a really hard day, can be amazing. I'm going to touch base on medication options. I'm not going to go in depth because psychiatric meds can go very in depth, and it also depends on what your treatment is. So it's very going to be case-to-case basis. But some of our categories of medications, we have first our SSRIs, or our selective serotonin reuptake inhibitors. The goal of an SSRI is to help our body basically suck in a little bit more of the serotonin from our neurotransmitters, which, serotonin is our happy drug in our body. Some SSRIs, for example, can be Zoloft, Prozac, Celexa, Lexapro. We also have our SNRIs, which are serotonin norepinephrine reuptake inhibitors. So as you can guess, it helps with the serotonin and norepinephrine being sucked up, by our neurotransmitters. These can include like Effexor, Cymbalta, which also can help with pain. We've got a slightly different category within that, which would include like Wellbutrin. So both of those classes are SSRIs or SNRI. We have a couple of other classes that can include like medications like Remeron. The goal of those two is they are first line for both depression, anxiety, and PTSD. So those are going to be our gold standards because we can use one medication to treat all three of those problems, and less is always more. We can think about some anxiolytics, benzodiazepines, alpha agonists. That can include some like hydroxyzine, which is similar to a Benadryl, but works more on anxiety than allergies. We've got our Buspar. We can use low doses of benzodiazepines like Ativan or Valium. You know, benzos can be addicting, so less is always more with that. But sometimes when we're going through a lot, we need the help. We can also use things like alpha agonists like Prazosin, which helps with PTSD, or Clonidine, which is also helps with PTSD and nightmares. It kind of helps our body come out of that fight or flight sort of feeling we can have. Hypnotics, those are to help you with sleep. We've got Trazodone, which is a really old antidepressant that helps more with sleep than depression. You can take higher doses of the hydroxyzine at night to help you sleep. Some patients take Ambien or Lunesta during that time. There's, of course, our over-the-counters like some melatonin, Unisom, Benadryl, and then side effect management medication. That's really going to come from your providers and like palliative care. But for example, we can take like gabapentin to help with that real nerve pain that we can get from the chemotherapy itself. But I encourage you always, always, always talk to your providers before starting any over-the-counter things or any natural supplements. Some of our natural supplements, they don't go through the FDA, so we don't always know where they're coming from or what's in it. And it's super important to talk to your provider first to make sure it's not going to interfere with your treatment at all. And when we think about medications and we think about therapy, this is really what I say to my patients. There's 60% is therapy and 40% is medication. If we do not use those things together, we are never going to reach that 100%. So really keep that in mind. We can only do so much with one thing. And then caregivers. Caregivers go through a lot. They are just downright amazing. Every step of the way, they are there for us. You know, it's important because caregivers really do experience some of the same mental health struggles that the patient does. Caregivers can feel just as anxious as the patient. They can also get scan anxiety without knowing what's going to happen next. They also may struggle with really knowing how to help us, what to say, how to feel. It's important for caregivers to really feel comfortable talking to their loved ones about emotions and feelings. Once we have some of these conversations, this can really reduce the stress of not knowing what to say. Caregivers should also highly consider joining support groups. Consider joining online groups that are geared specifically for caregivers. This is also a way for them to feel connected to others that understand their role, just as we need to find others that understand us. And our AYAs. AYA stands for Adolescent Young Adults, and that compromises the ages 15 to 39-year-olds. AYAs really experience unique challenges. They often end up getting grouped with either the children or the older patients, but not really this in-between section. You know, AYAs can really struggle with, forming relationships, planning for college, playing sports that they love that they hope to play in college. You know, we can worry about fertility and what our future and our future families hold. Worry about marriage. We may already have some young children at home that we're now trying to help while we also go through treatment. There's also a true loss of identity and independence that can happen during this time. We may feel that we're not meeting the life milestones like we want to, like attending college graduations or high school graduations. It's very difficult because we're in a very different time in our life. According to Stupid Cancer, which is a great resource for AYAs, in general, AYAs are the most underserved population by age. They are almost often misdiagnosed late. or I'm sorry, are often diagnosed late or misdiagnosed altogether. You know, it's really important for AYAs to join together. I think I've made that clear. We should all find each other. We should talk. We should feel connected. But I'm an AYA. I was diagnosed when I was 27, I think. I'm, you know, a mom, a wife, I'm a professional. And, you know, it's hard to understand, for people to understand what it feels like to have cancer during these specific times in our life. You know, there's often, look for AYAs, ask your providers. There's often support groups built into your hospital system that can really, you know, join you together with other patients the same ages as you. You know, there's also, just to name a few, Stupid Cancer supports a cancer con every year that's specifically geared for AYA members. And then we also have an AYA Awareness Week every April. You know, there's a lot of different ways we can go about talking to AYAs. You know, I think it's really important to remember that we want to be treated normal. I don't want you to walk on eggshells around us. You know, just because we have cancer doesn't mean we still can't enjoy some of the things in life, but it's also really helpful for people to be realistic at the same time. Over the next couple of months, you know, Sarcoma Alliance as a whole and me, I want to do some more blog posts, and we'll bring some more articles onto our website about the unique challenges of AYAs and just children in general through sarcoma. And then here's my big topic. It's okay not to feel okay. I'm just gonna put that right out there. I just want to be honest for just a minute. Cancer sucks. I have no other way to put that for you. We all cope in our own way. Some people really need to feel positive. They need to have that super sunny outlook every day, feel upbeat, feel happy, and that is their way of coping, and that's completely okay. However, I do want to touch on that positivity is not for everyone. And I was one of those people. I heard, you know, I don't know how many times, you're so brave, you're a warrior, you're so strong. Oh my gosh, you look great bald, you have such a good shaped head. Oh, you're so young. All of these positive things all the time. It was just, it got almost to an overwhelming point for me where I was just like, stop. I don't want to hear that every day. There's this term called toxic positivity that I didn't learn until I was done with treatment, but it really describes like this obsession with positive thinking and putting a positive spin on everything. You know, you might feel like you need to look less sick for other people. You have to put a smile on, or you have to put a fake face on just to make others feel comfortable. We might have to wear a scarf to cover our bald head because it makes other people more comfortable. I did not do that, by the way. I went to the grocery store every day and never wore a scarf. And I did notice it did make people more uncomfortable. But again, stigma of everything. But I really want to be here today to say all of our feelings during cancer are valid. You are not required to feel a certain way or portray yourself a certain way. Some days, to be honest, we just feel like total and complete crap. You don't want to put on a smile. You don't want to feel strong. You are just literally trying to survive day to day to day. And it's okay. But what's important with this is that you have to communicate to people around you. You need to tell them. I remember telling my husband, enough. I don't want you to tell me that I'm strong. I don't want you to say that I'm brave and I'm the strongest person you know. Enough is enough. Once I communicated that to him, though, it became easier and he understood what I needed to hear. But at the same time, people are just trying to help. When they're saying these things to you, it's just because they want to help and they don't know any other way to help. You know, again, we come back to the whole stigma. You know, they don't know how to talk about mental health or what to say. But the thing is, you know, as we talked earlier, mental health is stigmatized, but smiling is not. So smiling is more acceptable. But at the end of the day, here's what I say. You do you. We all have to get through cancer one way or the other. And it doesn't matter if you feel like you need to have a smiley outcome every day, more power to you. If you need to feel a little bit down and feel crappy one day, that's also cool. You know, each your own, really. But I find when I talk to a lot of patients, other patients, they really struggle with that constant feeling of positivity. And, we don't always want to feel that way. And I totally support you when you don't feel good today. And kind of just to wrap up, so there's a few positive things that we can feel about our mental health after we survive cancer. We may notice that we're forming a lot of deeper relationships. We are, following a healthier lifestyle. We are reevaluating some of our priorities and finding what we really truly love in life. Maybe you quit that desk job and you decided to go after your dreams. And we really start to see like ability of our own strength. After cancer, we really do recognize that, we did this and that means we can do more. Some degree of anxiety and distress is completely normal, but we have to consider, when is it becoming problematic in our life? Addressing your mental health is never a waste of time, and it is never a waste of money. So I do run the Mental Health Mondays on the blog on the Sarcoma Alliance. This is relatively new, but if you guys have topics or anything you want me to talk about or go over, please reach out to us. And yeah, I hope you enjoyed this and I hope it was helpful. And I'm really glad I was able to talk about this today.
Well, thank you so much. That was amazing. Thank you so much. You touched on a lot of different topics, and I think it should be helpful for everybody. There were some questions here or comments. Courtney, thank you for the great talk. Positivity can lead to lonely feelings, so agree with toxic positivity. Beautiful poem, Philip Larkin Obeyed. Sorry, I'm terrible with pronunciating things. So that so understands this. I'm a mental health provider. I went to palliative care after about a year of treatment and it clearly felt inappropriate. Do you have recommendations for oncology system changes?
We have a lot of system changes that have to come down the line. We need to build mental health into our very first appointments, and we need to build it in every single time we see providers, every single time we see anyone. We have to discuss mental health, and that's the only way we're going to make system changes. And it's not even within oncology specifically, it's within our entire medical system. But really, it's becoming more comfortable with talking about it. And providers really, if they don't, our oncologists are not specializing in mental health, but what they can do is send us to the right people. And being sent to palliative care and being sent to psycho-oncology is really the most important part. And the long run is we have a lot of changes that need to come as a whole.
And then, just to say about, people are always trying to help, they try to tell you nice things, or they're sending you, information. They say, oh, try this, they'll send herbal pills or whatever, and everyone's just trying to help, and it becomes a little bit overwhelming. So I usually, recommend to patients, put your friend on assignment instead of saying, oh, you need to eat this, or you need to take these pills. Oh, do you mind taking me to my appointment, or do you mind making me a sandwich, or kind of task them with something, because they just want to, people want to help you, so you can kind of refocus them on what they can do,
like what your needs are. And if you tell people how they can help, that's a lot easier than them just struggling to know, what can I do for you? I don't know what to say. I don't know what to do. But at the end of the day, like you said, please make me a turkey sandwich because I haven't eaten all day. And then they feel useful and they feel happy. And then you're also getting a turkey sandwich. So, hey, that's good.
A win-win. Okay. And then, okay. So how do you deal with stage 4 cancer, knowing that you do not have a chance for NED as per my oncologist?
Stage 4 cancer is hard. we don't exactly know what to do. We don't know what to say, but that doesn't mean that we still can't focus on our mental health during that time. Whether we have a day left, a month, or a year, we still have time that we want to spend, and we want to spend it feeling the best we can. And that's really where the mental health comes in, is, you know, setting you up for what the future is going to hold, helping you identify resources for your family, maybe journaling about yourself that you can leave for your family. Just because we have stage 4, and it doesn't necessarily mean like you are going to die either. Just as I think Gina touched on yesterday, stage 4 is not necessarily always a death sentence. It's scary as hell, but you know, it's still a time that we need to focus on what can we do. Again, what can we control? We can't control what's going on in our body sometimes, but we can control how we react to it. We can control, you know, what activities we do that day to occupy our brain. There's just so many things we can do. And I encourage you guys to look up other coping skills, because there's 1,001 of them that you can find. Even if one doesn't work, go to the next one.
And I think it's also important to have, you know, your hopes and dreams, and then your expectations, right? So, you know, we can all hope and dream for, you know, things, but if that's not going to, like, I can hope and dream I could become, you know, an opera singer, but it's like not realistic that I'm going to be an opera singer. I didn't even get a 5th grade chorus. So like, it's not happening. So, you know, it may not be, we can, you know, maybe somehow like God will grant me a great voice and I can do that. But if I have an expectation, well, you know what, maybe I'll try something else. So if you are stage 4 and you don't have and your doctor is saying, yes, we don't have a cure, or we're not going to get you NED, well, then what is the expectation? Well, that maybe the treatment that you're on can control the cancer and keep it at bay, and you can still live with the cancer. So that should be your expectation of life, living with the cancer, knowing it's in your body, instead of trying to focus on becoming NED or cured, because then you're never going to be happy. But if you have their expectation, okay, cancer is still there, and then you get the scan, and then the scan shows, oh, cancer is still there, but it's under control. Okay, you can be happy with the results. With, of course, our hope that you never know. You know, there could be cures out there, could be other treatments. So you have to keep the hope alive, but separate it from your expectations.
Mm-hmm. Great.
Thank you so much, Courtney. Very important topic, and I learned a lot as well. So we really appreciate your time and your volunteerism as well.
And I do agree with laughing is important. You know, there's a lot of cheeky comedies out there, Netflix, all that stuff. So we should probably give a list of like things to make people laugh. So
yeah, laughter is most definitely the best medicine, right? Yes.
And it's okay to try to put some out there, and then others are, you know, you try 10, maybe 2 are good. You never know. Sorry, I don't mean to. I know.
No worries.
Okay.